As a reminder, what ballot measure 110 does, it decriminalizes small personal use amounts of drugs. It does not legalize drugs. It essentially removes criminal penalties for possession of small amounts in favor of a health-based, science-backed approach to substance use.
Measure 110 continues to be a big topic of conversation at the local Alcohol and Drug Planning Committee meetings because it makes significant changes in the law about how drug-related offenses are handled. At this month's meeting, representatives from the Health Justice Recovery Alliance, an organization whose sole purpose is to ensure Measure 110 is implemented according to how voters intended, gave a detailed update about its progress.
Just as a reminder, what ballot measure 110 does, it decriminalizes small personal use amounts of drugs. It does not legalize drugs. It essentially removes criminal penalties for possession of small amounts in favor of a health-based, science-backed approach to substance use. It was specifically tailored to meet the needs of Oregon, drawing on best global practices and the idea that rather than labeling drug users as criminal, Measure 110 treats substance use as a public health issue. As a result of Measure 110, people in our communities seeking harm reduction and addiction recovery services will now be able to access those services more quickly, closer to home, and by someone who shares their culture and/or language. Once ballot measure 110 passed during the 2021 legislative session, the Senate Judiciary Committee renamed itself the Senate Judiciary Committee on Ballot Measure 110 Implementation. And they brought together key stakeholders from all over the state. And they worked through ballot measure 110 and made some significant adjustments. First being, they established behavioral health resource networks in all 36 counties. That was number one. Number two, directed the Oversight and Accountability Council to prioritize funding for communities that were most impacted by the war on drugs. Out of this $302 million, the Oversight and Accountability Council set aside 4% to be distributed among the tribes. They came up with their own formula to develop Measure 110 services in their communities based on that allocation. Senate Bill 755 also established that youth be referred to the juvenile system rather than adult courts, and youth can also be required to sign a accountability agreement with the court. Senate Bill 755 restated that law enforcement will give information about how to obtain a screening to individuals that get the E-class violation. And the last thing is that the Secretary of State's office will be conducting regular audits that focus on compliance, financial, and performance accountability measures. Also, during the legislative session of 2021, the leadership of the legislature thought that it was important that, based on advocacy from partners, from community partners, providers, and our organization, that it would be important to get funds out right away to community organizations. And through the HCRA's advocacy with the governor's office and the legislature and working with the Oregon Health Authority, we were able to get initial $30 million out from the Measure 110 funds that was invested in organizations all over the state. 70 organizations in 26 counties received funding for access to care grants in that initial release. And according to OHA's own data, more than 16,000 Oregonians accessed services in the first 6 months. The $302 million that was appropriated by the legislature for this biennium represents a 5-time increase in non-Medicaid funding for Oregon.
What's a behavioral health resource network, or what we call a BURN? BURNs are a set of providers working together as a network to increase access to low barrier addiction services. At least one must be established in each county and offer all these services. Keep in mind, in some counties, there's going to be more than one. these are the main things that they have to have. Behavioral health treatment that is evidence-based, trauma-informed, culturally specific, linguistically accessible, and patient-centered. It has to offer peer support and recovery services, and those are designed to help people continue to address their substance use, housing, low barrier, temporary, stable, and permanent housing, as well as harm reduction interventions, including overdose prevention, access to naloxone, along with drug education and outreach.
There were over 335 organizations considered. There were 239 that were approved to enter into the negotiation phase. And as you can see here, of the 36 counties, 35 counties have been approved by the Oversight and Accountability Council to move their burns funding forward and receive funding. The only one that remains, as you can see, is Jackson County. But what that means for your community, and what we did was the HJRA went through the approvals and looked at all the organizations per county and how much the number of organizations that were approved to continue forward. We got this from the Oregon Health Authority's information, and then how much was allocated to each county. And this represents Jackson County and the organizations that are being funded and the amount allocated for the entire county.